Welcome to Health Diary. My name is Winnie Lubembe and we're coming to you from Polycare Wellness Center right here in Nyari. Now, most of us in our day-to-day activities, we find ourselves maybe not having a good posture, or sometimes we encounter pain in different parts of our body. And most of the time, we'd usually go to a hospital or maybe not seek care. Well, how about you try out chiropractic care? What exactly is it about and who needs to go for chiropractic care? Well, we find out after this fact of the matter. Chiropractic is a healthcare discipline that emphasizes the inherent recuperative power of the body to heal itself without use of drugs or surgery. The practice of chiropractic focuses on the relationship between structure, primarily the spine, and function as coordinated by the nervous system, and how that relationship affects the preservation and restoration of health. For some medical conditions, chiropractic services may complement or support medical treatment by relieving the musculoskeletal aspects associated with the condition. Well, now let's get to understand more about chiropractic care and adjustment. And of course, to help us drive that conversation, I am joined by Dr. Margaret Stower, who is a chiropractor and physiotherapist right here at Polycare Wellness Center in Nyari. How are you doing today?
I'm doing fine. Thank you very much for having us.
And thank you for hosting us today. And of course, we'll also have Lavender, who's here to share her experience as far as chiropractic care and her journey as well. Thank you so much for agreeing to speak with us. How are you doing today?
Much better, thank you.
I love that, much better. All right, so Dr. let's first of all just get to understand chiropractic care. What is it all about? Quite a big word.
Yes, it is.
Yeah.
Chiropractic is a primary health care profession that deals with the neuromuscular system of the body. That's the nerves, the skeleton, and the muscles of the body, and how that affects overall health of the human being. We come from the premise that the body has the ability to heal itself without too much intervention, without surgery, without drugs. You just have to give it time.
Okay. Then when you say you deal with, again, different areas of the body, but most of the time it's the musculoskeletal system yes. of the body. Right. So then that begs the question, what are some of the illnesses, diseases, conditions that you mostly deal with or that require chiropractic care?
Yeah, chiropractic care has been focused a lot on back pain, neck pain, shoulder, migraine headaches, anything to do with the skeletal system of the body. Yeah. But I can tell you it goes even further than just the skeletal system of the body. Because when we're looking at the spine, and that's the structure of the human body, it has functionalities. Okay. And all that function is regulated by the nervous system of the body. So really, you need to know how your nervous system is flowing through the vertebral column so that you can get health.
Okay. And of course, I'll come back to you to understand then what else, does this entail. But let's speak to Lavender. So you had issues with your back since 2015, right? After the birth of your baby.
Yes.
What exactly happened?
I gained too much weight first, and then I had a fall right after giving birth, which made the situation worse with my back. And back pain continued for years until I could not take it anymore. And doctors were suggesting I should have surgery to rectify the problem, but I sought to have another care instead of surgery.
All right. So where exactly on your back do you have like most issues, and could you describe that pain for us?
Oh, the pain was excruciating. For so long I could not carry my baby. I had to have someone to carry my baby for me. I could not manage to lift weight, and it was only like 4 kilograms. So you can imagine that is not easy. Bending is a problem, sitting is a problem.
All right. So and where exactly? Your back? Is
from the middle part all the way to the lower back.
Okay.
Yeah.
All right. And of course, so Dr. Margaret, in terms of then that type of pain, and she says, of course, first of all, pregnancy and childbirth, there's a way that interferes with your spine, right? And then adding in the fall.
Right.
That's then completely messes up with the spine. So when she says the middle part of the back and then all the way down, so what exactly happens at that part of the back of the spine?
Right.
Yeah.
If you can recall, Lavender had a pregnancy, and of course she was carrying the baby, and of course the weight of the baby tends to throw your spine out of sync, so you're a bit off. So you're really the baby's growing, and you're if you don't have strong core muscles, then of course there's a weight on there and you're straining your back. So I think that was the initial thing. But then of course she had an injury as well. So that actually may have impacted also her spine. So in that case, she was continuing with what she has to do on a daily basis, but it was still impacting her. So as much as the body tries to cope with that, there's still things that we need to look at and see how you can be able to manage with that kind of trauma in your spine.
All right. And aside from, again, pregnancy and the fall, what are some of these like other conditions that, again, might put someone at a place where they would need chiropractic care?
Yeah, some of the conditions that I see mostly is really migraine headaches. And most of the time, migraines could be caused by anything. You know, it could be either some allergies that you've been having or some tension in the neck. Most of the time it's because of our ergonomics. So most people are sitting, facing down and working so hard, and then they have this tightness in the neck muscle, which causes tension to the nerves that supply your head and the vessels that go to the head. So you have this little tension headache that might just be because of your structure in the neck and the fact that you've lost your normal curvature over there, the neck area, and just need an adjustment so that it can get back to normal. Really goes beyond just the skeletal system and the back and neck. We look at other things. Some people would have actually gastric, what we call gastric reflex. And that's because the nerve that lies that area has been compromised, and you just need to look and locate which area is not moving properly. The vertebral column has got 24 vertebrae, right from the one that holds the head, the skull, up to the one that goes to the tailbone. That way, in between the vertebra is a disc. The disc's function is really to absorb pressures and shocks as we go ahead in our daily lives. And in between that disc comes the nerves. So the nerves are the ones that are responsible for pain, for touch, for sensation. And if there's a little kink there, or a bit of pressure there, then of course you're not getting a full flow of energy to your body. It's like an electrical conduit, you know, like an electrical cord. So there's not enough energy flowing in.
And for you, you said before you started your chiropractic journey, you went for like physiotherapies and all those things, but it didn't work.
I went for several treatments. You can imagine since 2015 until 2019. I have gone even for a nerve block. What they take you in the theater and they block your nerves so that you don't feel the pain. It worked for maybe 4 months, but after that, all the pills I've been taking, Panadol, I've been taking like to numb the pain. It didn't work. Massages and other treatments that didn't work. Actually, maybe made it even more worse, if I must say.
So in a room, for example, I come in and say, "Hi, I'm having issues with my back," and because there's no injection, there's no medication, there's no like heavy equipment to poke me under, all those things. So then what happens? Do you massage? Do you stretch? Do you, what exactly happens?
Knowing the history of the patient and impacting your energy over to the patient. Make sure that you've talked to them, you've let them calm down a little bit. And then you go into the fact of palpation. And as I said, we are trained with our hands to know exactly which area is not moving properly. You also do your anatomy, your physiology, you know which muscles are tight, which one should be moving this side. So the orthopedic testing is what guides the chiropractor on how and where to adjust. And we work very closely with the other disciplines of our profession, such that if you need it, if they need to see somebody else, we'd refer out to the consultants.
Okay.
Say, okay, this one we can't really manage. Can you take over the management of the care?
All right.
So that you actually make sure that the patient gets the best out of you.
But for you, so when you came in, so what exactly happened? Because from what I've seen in the videos I've seen on Chiropractic, is someone sort of like pulling you, stretching you like this, and then this other side is that what happened for you? What exactly happened?
I would say it's pain that is very with a lot of gains.
Yeah, okay.
The initial pain, afterwards you gain a lot, because from the first time I started the treatment, I would call the doctor even in the middle of the night. I'm in severe pain, and she says, just hang in there. In the next, at least after 8 hours, you will feel the relief. And sure enough, there's a lot
you feel
of
the relief.
Yes.
After how long did you start feeling a bit of relief, a bit of the pain subsiding?
By the second month, I was to maybe 85% recovered.
85.
Yes.
Within 2 months.
Yes, because it was. I came to Polycare consistently in a week, 4 times a week.
Okay.
4 times a week.
All right.
My sessions were 4 times a week consistently.
Okay.
I never missed even one.
All right.
Session.
Okay.
So by the second month, I was 85%.
Yeah.
And by the 4th month, I was 100%.
And it's very interesting because we were talking about this earlier on, and you're saying you're also in Taekwondo, and I'm like, wow, okay.
I'm able to
practice all the things.
Yes.
So it's interesting, but I'm pretty sure people watching and thinking, okay, I need to see how this works for me to, really understand what that is all about. But hanging there, we're taking a short break. When we come back, of course, Dr. Margaret will be showing us all the different forms of chiropractic care that you need to know and where exactly to touch. Okay, you do not want to miss that part. Stay with us. This is Health Diary. All right, welcome back. This is Health Diary, and today it's all about chiropractic care and adjustment, and we're right here at Polycare Wellness Center in Nyari, where Dr. Margaret Storer, who's a chiropractor and physiotherapist, is helping us really understand what chiropractic care is all about, as well as Lavender, who again shared her experience as far as issues with her back is concerned. But right now, we want to show you what exactly chiropractic care is all about, right? And of course, Dr. Margaret is ready with Lavender. We're still with her. So, Dr. what exactly are you about to do?
So we're going to palpate. We're just going to feel you and see how your motion is. I want you to look up to the ceiling. Just drop your head back. Does that hurt?
Not so much.
Not so much. Okay. And then chin to chest. Look down. Any pain?
No.
All right. Center. Look over your right shoulder. Let's have a feel of that. That's good. And over to your left side. Look over your left. That's good. You can see at her left, she's kind of just a little bit tense there, and the motion is not as smooth as it should be. So I'll probably just palpate to see, and actually when you palpate here, this muscle, which is a trapezius, is tighter than this side. So the lateral muscle that connects the shoulder to the neck, because the neck muscles come from here connecting to the shoulder. Then I want to look at the shoulder. I want you to lift up your arm. Let's see that. Any pain?
Yes.
All right. Let's have a feel of that. And I always compare the right or the left side, so you see this one is much easier on. All right, Linda, I want you to hold your shoulder, your elbows this way. Let's motion the thoracic areas, which is your upper part. Okay, so here, place your forehead here. Forehead, right. I'm going to grab you here. We're just going to feel this. We're just going to go up. Tell me if it hurts. Any pain?
No.
Good. And let's go further. Any pain?
No.
And this way? Yeah, that's a bit tight here. I want you to look over to the right side and over to the left. Okay, very good. So a little bit of tightness right here and of course the neck area. That's interesting because the body tends to compensate, meaning if one side is not really functioning well, the other side takes over and there's a lot of build-up of tension on the other side.
So you're saying adjusting.
Adjusting.
So what exactly will that, I'm curious to understand how that's going to happen.
All right. What Linda has muscles that are tight from here. And of course the muscles attach onto these little bones here, the vertebral bones. These are the vertebrae. So when you feel it, like I was feeling it and motioning it, it wasn't moving as good as it should. So an adjustment is really just resetting it, placing a little force there to kind of realign it.
Okay.
Because the body is supposed to be in alignment. But because of what we do, and
several things that happen, day-to-day activities that causes the misalignment. Are there people who are excluded
from chiropractic?
Yes.
Not at all. I've adjusted a baby who's 3 weeks old, and I've adjusted a 94-year-old. So one of the things we tend to do is look at the leg lengths, because if there's a shortening somewhere, then you know there's a pull. So here, she just has a little bit on this side, but that's not too bad. Of course, we are not completely, equal. There's always one side that would be a little bit longer than the other, but it's just millimeters of a difference. Okay. But when you look at someone with a problem, you actually see a little bit more difference in there. So I'm going to bend this knee, hold it. I'm going to place my hands on your hip. Is that okay? All right. And we're just motioning the hip here. If it's painful, let me know. We're just looking at the mobility in that particular area. And again, I'm going to do that on your right side and bend it and, of course, motion it up. If it's painful, let me know. So we're really looking at the joints. The body is full of joints, one after the other, that articulate with each other. So we must make sure that we are covering everything. So I'm going to palpate your back. Palpation is one of the techniques that chiropractors use to just feel the tension between the right and the left, and you're looking at the articulation of the vertebra from one side to the other. Okay. And of course, we can feel it through the clothing. So it's just right through.
So when someone comes in with pain, and another one who just comes in for adjustment, is the technique the same or is it different?
It's the same. If you're just coming for a regular check, I tend to have a rule of thumb, which means if you're 10 years old, you come in once a year. If you're 20, twice a year. If you're in your 30s, the older, the more frequent you need to come for a checkup.
All right. But at the same time, are there like risks associated with chiropractic care?
That's why we have to be very well trained. And I always tell people, don't go to the barbers and let them wing your neck, because they're not trained to see which particular area to be adjusted. You have to go to someone who has been trained, who knows exactly which area to focus on.
What could happen if you go to someone who's not trained? Like
you cause more harm. You might cause a fracture because of the force that you're placing on the spine. You might increase the tension in the tissue as well. And then, of course, if you're getting an adjustment by someone who's not trained, you're adjusting a vertebra, which is not supposed to be adjusted. So you're actually setting a person off rather than aligning
the body. So what are you feeling now with lavender today?
I'm feeling the tightness in the tissue. And then I did feel that I need to adjust this particular vertebra, and I'll need to adjust her neck. So we start off here, and all you need to do, Lavender, is take a deep breath in for me, and out.
Isn't that painful? Because I had that. And it was not just one.
It was 2 years. It was right in there.
So there's no pain, there's no machine, there's no all this heavy, things that are needed. So then when it comes to the recovery time, what does that look like for someone who seeks chiropractic care?
The recovery time is really the advice that you need to follow through. Because really you cannot be adjusted, but you go back and sit in long periods of time, or you go use, sleep in awkward positions. So it's really the advice that you're getting from your clinical care that helps you hold that that adjustment for as long as you can.
Okay.
As I said, if you're in your 30s, you come in,
Yeah.
you know, every quarter.
Every four. Okay.
Yeah.
I'm really scared, but I want to try.
Okay. It's not painful at all.
She's very encouraging. She's like, it's not painful. So very quickly, what is it that you can do for me?
Okay, Winnie, what we're going to start with is really look at your alignment and look at your posture. Okay. So we're going to ask you to move your shoes and just stand against the screen.
All right, thanks. Okay, shoes out.
Out. And you can actually see her right shoulder is a little bit higher than the left side, and then she's leaning a bit onto your...
To my right.
Yeah.
This is
That's
right.
That's your right. Yeah. The
Yeah.
high shoulder and really this way.
Okay.
So I want you to turn and face this way, Winnie.
This way.
Yeah. Just look through that. So over here, I'm looking at the head coverage. So I look at the way her head is sitting on her shoulders, and she has a little bit anterior carriage, meaning getting her chin out more.
Yeah.
So if I was to correct you, I probably want to ask you to be always tucking in your chin a bit this way.
Okay.
Yeah, that's fine, but still a lot of tension here. Okay,
all right.
Come this side.
Okay.
What you're going to do, let's have you seated here and let's face this way.
Seated and face
this side.
Okay.
Yeah, I'm just still going to examine your... All right, can you look up to the ceiling? Look up, look up, look up, look up, look up, look up. Yeah, that's good. Look over your right shoulder, Winnie. That's it. Very good motion there. And to the left. Yeah, a little bit guarded going to the left. It's this tension here. Right, I'd like you to drop your right ear towards your shoulder and then the other side. Excellent. Okay, center. I want you to hold your elbows here. Place your forehead in the center. Okay. You're going to grab hold of your arms here. You're going to go up and just feel this. Yeah, I can feel that.
Okay.
Right. And again here. Yeah. And there. Just the way we do what we do work, you know, you tend to get a lot of tension in the shoulders.
Yes.
Check up your leg lengths to see. And you're going to bend that. That's good. Well done. And you're going to go here. All right. I'm going to just give you a little pull here. That's good. Well done.
Yes.
You're going to bend right through. And all the time you're looking at how motion between the right and the left, just the functionality of the right side compared to the left side. Because the body is enclosed in a fascia, which needs to be stretched, and here and over this way. Relax, relax, relax. A little bit of tightness in the hip area. Are you okay?
Yes.
You're very brave. But it won't hurt. Just motioning it. Just relax. Just relax. Right here. And your hair. A little bit here. That's it. Actually, these ones need to move like that one and this one. Can you feel the tension there?
Yes.
So we're going to start off with that thoracic area. Take a deep breath in. Out, Winnie. Just relax, relax.
Ooh. Oh wow. I had that. Okay.
Around, lie on your back.
Okay.
All right, hands on your tummy. That's it. We're just gonna focus a bit on the neck area. All right, just here. Just relax, 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 relax. Ooh. That's it. And relax and relax and relax. Get going. Relax. It's all right. It's okay. The worst is over. All right. I'm going to give you a little traction here. That's good. Well done.
Okay.
Excellent. That's it. Well done. You can sit down.
Wow. Oh, that feels really good.
Yes, that was good.
It really feels so good. All right, and on that note, we have to say goodbye right here on the Health Diary, but it was such an interesting, episode. I got adjusted, and I will tell you, it feels really good. It's not painful, and I just want to say special thanks to Dr. Margaret Storr, who's a chiropractor and physiotherapist right here at Polycare Wellness Center in Nyari. It's Dr. We've learned a lot. I've learned a lot, and I think from here on, I'm gonna come for more adjustments. Before we say goodbye, take a look at this health tip.
In this video, I'm going to demonstrate how to do Pike Crunches. This exercise is excellent if you have lower back pain or a back injury and you want to tone your ab muscles. Make sure you squeeze your abdominal muscles as you crunch and raise your foot as high as possible. Squeeze your abs in this position. Squeeze. The way to make this exercise more effective is to hold a light dumbbell. You don't want to use a very heavy one because it will mess up with your form. Here now I'm engaging my arm muscles more. The worst thing you can do for your back when you have back pain is to do sit-ups and crunches. That only hurts your back.
Well, that's it for today's episode of Health Diary. And of course, we were here at Polycare Wellness Center in Nyeri. And special thanks to Dr. Margaret Store, who hosted us today. She's a chiropractor as well as a physiotherapist. And of course, not forgetting Lavender, who shared her experience with us as far as her journey with chiropractic care. So if you have any other question, feel free to interact with us on our social media platforms. But until next time, adios.
Up, up, up. That's good. Well done. Up and just feel this. I can feel that.
You're very brave.
Ooh, oh wow.
This is all right. It's okay.
It really feels so good. Can I finish here? Yeah. Papa.